Hello, my name is Dr. James Cassell. I'm a physical therapist and I work at the Armonk office for ProClinix Sports PT. This is Eric Fates. He's a certified athletic trainer with a master's in kinesiology. And today we're going to be going over a couple of shoulder stretches to address just some general pain that people may have. So we see the shoulder most frequently in the clinic and tends to not be anything traumatic. It tends to be more of a postural related injury and just a repetitive use injury. A lot of times the things that we do in life have us doing things in front of our bodies, so we tend to get really tight through the chest area and sometimes also through our necks, and we get weak in our back. So it kind of makes your shoulder blades roll forward, and that can cause some pinching on the front of your shoulder or also on the sides where the rotator cuff tendons are, which can cause pain, typically with overhead movements. So while you'd want to get a physical therapist to evaluate you to pinpoint what your specific injury is, these are just going to be some general stretches that you can try at home, and if you still have pain afterwards, you may want to consult a physical therapist. So the first stretch that we're going to do is I'm going to have Eric demonstrate a lat stretch. The lats are the big muscles on the sides of your body here. So all you need is a bar or something sturdy to grab a hold of. So he's going to grab a hold with his right hand, and then he's going to shift his body weight backwards. And then what that does is it gets a nice big stretch through the latissimus dorsi, and then he can kind of shift his body away a little bit to get a little bit more stretch depending on your body mechanics. So he's going to hold this stretch for 30 seconds. When you do the stretch, you really want to try and stay put and not bounce around. The 20 to 60 second range is really the sweet spot for static stretching. And this muscle tends to get tight just from being in that rounded position because it is also a shoulder internal rotator. All right, good. The next stretch we're going to go over is a ball rollout stretch. So he's going to be seated in the chair. If you don't have a physio ball at home, you could do this on an ottoman or a stool, something that slides. So he's just going to roll the ball forward, very similar to the last stretch, but this also helps to improve his thoracic mobility, which can get really stiff, especially if you're sitting most of the day at home. And then if you're tighter on one side versus the other, go ahead and go to one side. So you can roll the ball to one side. So right now he's rolling to the right, which is increasing the stretch on the left side of his body. And similar to the last stretch, you'd want to hold this for about 30 seconds, and then you can roll over to the other side. Same thing, 30-second stretch, working on that lat and working on improving your thoracic mobility. Good. All right, next stretch we're going to do, just need a door frame. This is a pec stretch. So again, when you're sitting for extended periods of time, we just kind of naturally roll our shoulders forward, and then over time, the pec muscles adapt to that shortened position and actually become shorter. So a great stretch to address this tightness is a pec stretch. All you need is a door frame. What you do is stretch in the left side right now. You put your forearm against the door frame. You are not pushing into the door frame, it's just resting against it. Then he's going to lean forward and rotate his body away from the arm that he's stretching. So we're looking for a stretch through the front of the chest. If you have discomfort in the top of your shoulder or the back of the shoulder, you're going to need to play around with the angle of your arm or find a different stretch because we don't want to be pinching any structures while we're doing the pec stretch. Same as the prior stretches, 30 seconds. Then you can do the opposite side. For this demo, we're just going to do the left. Good. And one more stretch. So this last one, if you're getting any kind of pain in the back of your shoulder, this is a really great one, very easy to do. Eric's going to demonstrate it lying down. You can also do it standing. It's a posterior capsule stretch, so he's going to be stretching this area back here. So go ahead. Perfect. All he's doing here is he's pulling his arm across his chest like so. The table is helping to pin his shoulder blade down a little bit, and he's feeling a stretch in the back of the shoulder here. Same as the other ones, 30-second hold, and then you'd want to relax, and then you can do the other side if you have pain at both shoulders. And as I had mentioned, you can also do this sitting. And then that's 4 general stretches for shoulder discomfort that we use with a lot of patients who have shoulder pain. If you find that you're having pain that's lasting and not going away and not getting any improvement from any of the stretches that we demonstrated today, you'd want to make an appointment to come on in and get evaluated and see if there's anything else going on. And next week we're going to incorporate some strengthening exercises for the shoulder.